Welcome, welcome everyone to the Doctor Janine Show. I'm so happy to have you all here today. We have a great show planned for you. I'm so excited. Now you can see there's a little problem here that my glass is empty. We will be making another holiday mocktail with cranberries. Amazing, that is coming up. I'm gonna have to wait for that myself. And we're talking, guess what? What is this? This is fat. Yes, and we're talking weight loss and how most people are getting it all wrong when they're trying to lose weight and gain weight for that matter as well, because it's related to hormones. And the big one that I'm talking about today is leptin and leptin resistance, and why you need to get this under control to be able to get that weight off for good. And more importantly, you won't be craving all the wrong foods. I know we're going into holiday season. It's a difficult time for a lot of people who love their sweets and their treats and the alcohol and all those things. Well, this show is for you, especially if you're trying to lose that weight. We're also talking about vitamin D deficiency. So if you live in a place where you don't have a lot of natural sunlight exposure right now, this is a problem, because what else can happen when you're vitamin D deficient? Yes, you can gain more weight. Your metabolism gets sluggish. We're going to talk about all the signs and symptoms of a vitamin D deficiency as well today, which is so amazing. Please say hello, everyone. I'm so happy to have you all here. And let me know where you're from. Beach in Nebraska. Love to see you. I'm so glad you love the show, Beach. Thank you so much for tuning in. And it's so great to have Beezeeb here as well. Good morning. Thank you for tuning in. Please, Carol, nice to see you as well. Please let me know where you're tuning in from. Just say hello and put some smiles on my face. I love all those hearts that come through. So I appreciate everybody double tapping their screen throughout the show. I know you get a workout, which is so much fun as well. Be sure to share today's live as well. And if you're a new follower, make sure that you're following me, subscribe to my channel so that you're always getting my latest and newest information. Okay, so I have to give up the fat for a second. We're also talking back exercises, so strengthening our back today, which a great exercise. It's a one and done. It's something that you can do so easily. You don't even need to have weights at home. You can just pick up anything heavy. I'm going to show you that as well. And yes, that holiday cranberry mocktail is coming up, which I'm so excited about. And we're also making a hair mask, one of my favorite things to do for luscious hair and shiny hair and healthy hair, to help with hair growth as well. So depending on, vitamin D deficiency, we're going to talk about hair and vitamin D, that link as well. Thank you so much for tuning in today. Now, if you missed last week's show, we talked about why fruit juice is so dangerous. We talked about a fatty liver detox tips. So if you missed that, make sure you tune in and check out last week's episode. We also talked about leaky gut syndrome, and we made another mocktail. How many of you made the spicy margarita mocktail, either with or without the alcohol? Please let me know. Put a one in the comments if you were able to make that mocktail. So delicious. Okay, let's get started. Now let's talk a little bit about leptin resistance and why this is so important that we're getting our hormones in check when we're talking. And yeah, let's talk about that fat. And if you're trying to lose that weight, because we've got different types of fat. We've got that subcutaneous fat, which is beneath the skin surface, which we see in this little butt cheek here. Has everybody seen the butt cheek before? You know how I name everything in the show. Lucy's waiting for us in the kitchen. Yes, she is. She's here today. I don't know, maybe give me some names for butt cheeks. I don't know if that's appropriate, but hey, we're having fun here on the Doctor Janine Show. So that subcutaneous fat underneath the skin surface can be something that, of course, we don't like. This is just 5 pounds of fat that I'm holding onto here. So if you're needing to lose 5, 10, 15 pounds, we've got to fix that leptin and that leptin signaling. So this is so important. Now, we will be going back to the beauty set in just a second. I'm going to show you that beautiful hair mask, which you're going to love. But we need to balance these hormones in order to be able to maintain our weight. So let's go through some of the symptoms. How do you know that you've got leptin resistance? How do you know that this whole hormonal signaling is out of whack? Let's talk about this. Okay, first symptom, and you can screenshot this list when I'm done. Weight loss or weight gain. So either you've lost a lot of weight because maybe you've got an overactive thyroid. Hyperthyroidism is very much related to leptin resistance. So it's not just for the people who are wanting to lose weight. This is for people who want to gain weight as well. All of these tips apply, okay? So weight loss or weight gain, of course, because your leptin signaling is messed up. Number 2, you're hungry all the time and you're always craving the wrong food. So it's usually the carbohydrates, the sugars, all of the nasty stuff that we shouldn't be eating, which we know unfortunately makes us gain more weight. We just can't help ourselves because of that leptin signaling. So this is so important with leptin resistance. This is why we need to fix leptin resistance. And don't worry, because my tips are coming up on how to fix this, okay? Number 3, Sleep disorders, you've got issues with proper sleep, proper melatonin secretion. Okay, so this is a big thing. We know that we burn the most fat when? When do we burn the most fat? When does it leave our body? It leaves our body when we sleep through our breath. That's how we actually mobilize our fat. So a lot of people don't know that. It's something that I share on television all the time, and it's so shocking, I know. But imagine if you're not sleeping, why are you gaining that weight? Well, this could be one of the reasons. Your hormones are out of balance, your leptin signaling is messed up, and you're not breathing out your fat. You're not able to oxidize it properly. Your metabolism is sluggish. Okay, before I continue with my list, please hit that share button. Share with 10 people right now. I want everybody to join in on the fun today of today's live. Double tap your screen as well and show me all that love and those likes, all those hearts coming through. I see that. Thank you so much. It's so amazing that you're all here today, which is amazing. Okay, let's continue. Leptin resistance. Another issue is inflammation. So if you've got a lot of pain in your body, you wake up sore, you go to bed sore, you've got pain and inflammation, this is another sign of leptin resistance. And then one of the things that can be checked in your blood work is called the highly sensitive CRP. That's a blood test that you can check for. If it's high, that's an indication. It really should be down near 1 or 0. If it's high, that's an indication of that leptin resistance, okay? So it's something that you definitely need to have checked. As well as number 5, hormonal imbalances. So this can relate to infertility. So for men and women who have fertility issues, leptin resistance is something that needs to be fixed. Number 6 on the list is fatigue, lack of energy. Yeah, this is a big one. The hormones are out of balance. You're not getting that good night's sleep. Your leptin is messed up. Your leptin highest secretion is around midnight to 1 a.m. So if you're not having a good routine with your sleep, then your leptin gets messed up, and now you have that fatigue and lack of energy throughout the day. And number 7, insulin resistance. So yeah, you can't even now access that body fat that you're trying to burn off because your insulin isn't working properly to help to stabilize your blood glucose levels. So maybe you're pre-diabetic, diabetic. This is something that we definitely have to optimize our leptin and fix our leptin resistance, and my tips are coming up. Okay, we're going over here now. Please say hello. It's so great to have you. Thai baby, yes, if your weight is stuck at the same level, great point. Leptin resistance. It's something that you have to do something different to get that metabolism going. You got to fix those hormones and stabilize that leptin signaling. Yes, Bianchi Stitches, yes, that amount of sleep. So at least 8 hours of sleep is optimal. 7.5 to 8 hours is what the research shows, which is so important for a good night's sleep. And that's when our body detoxifies as well when we sleep. I've got other episodes where I talk specifically about sleep and sleep tips, so make sure you check that out if you've missed it before. Okay, so I do want to call this out. So a lot of you know that I'm writing my next book in my series now of the Healthy Millionaire series. And I'm working on it diligently, and it's due to come out next year. I'm super, super excited, but please share your story. I know a number of you have actually shared, not in a formal way, but you've shared on social media that you've done really well with all of my tips for leptin resistance. And if you can please send your stories to me, and your story, and it can be totally anonymous. I don't need to use your name. I don't need to use any of your contact information, nothing. I don't have to even put your name. If you would like me to put your first name, I can certainly do that. But please submit your stories to this email address, info@drj9live.com. Please send your stories of success that you have experienced. Screenshot that so you've got it really quickly. And that deadline is December 22nd. So I need all of those submissions in so that I can, I'm working with my editor right now diligently to get those last edits of the book done. So please send me your stories. Hey, if it's anything that I've talked about, of course, in my book, I'm talking about leptin resistance. So that it would be great. But if you've lost weight, if you've been able to lower your carbohydrates, I don't care what you've learned from me, please send in your story so that perhaps you could be featured in my book, which is super exciting. And I appreciate all the feedback that you always share on social media. But let's do this in a great way. Now, Frankie is asking, how do we fix leptin? Well, here are my tips how to fix your leptin resistance. And this is so, so important. And the good news is that it's super simple. And it's something that I had leptin resistance. I didn't even know. And until I actually fixed all of my hormones, with fixing that leptin resistance, did I see those changes in my health and my energy? I don't crave, the carbohydrates and things anymore. Huge, huge difference for me. And of course, you can see I'm always got loads of energy, right? So this is amazing because so many people are suffering. You're going to the caffeine, you're going to the sugar, you're going to all the things to boost up your energy, and you don't have that vital energy. You got to look at the root cause, and that's what I do as a naturopathic doctor. Okay. So let's talk about, we're going over here now. We're also going to be talking about vitamin D deficiency today and how your body is telling you that you may be low in vitamin D. So signs and symptoms of vitamin D deficiency, we're coming back to that. Okay, how do we fix this leptin signaling? Okay, number one on the list is using ice packs. So cold exposure, you know how cold exposure is all the rage now, Wim Hof and doing all these great things, jumping into cold lakes and things. Well, you can do this easily at home. You don't have to start with jumping in and doing the ice baths. This is probably your end game, what you're, inspiring yourself to do. You can start with the cold showers. You can start with just a simple ice pack on your belly in the evening I do this when I'm working on the computer, if I'm watching a program. Put that there because this is going to signal your leptin signals now, and your leptin receptors become more active to fix that leptin resistance. It does amazing things. So you want some cold exposure. I've got other videos on some specific spots to put it. There is a big acupuncture point here at the small of your back. So if you put that there, that is going to help to cool your entire body. So just in your low back area, if you put your ice pack there, it cools your entire body very quickly, okay? Another one is there's wind points in traditional Chinese medicine on the back of your neck. You can put the ice pack there as well. That will cool you very quickly. And anything cold on the face is going to cool your entire body very quickly, okay? Great for anxiety as well as to use it on the face. All right, that was tip number one. To fix your leptin resistance, but more importantly for balancing your hormones, this is gonna sort of wake up those leptin receptors, which is so important. Okay, tip number two, you're gonna decrease those carbohydrates. I'm sorry, you just gotta decrease the carbohydrates. But here's the thing, as you start fixing your leptin resistance, which is what happened for me, you don't crave them anymore. And that is such a blessing. I know that you're thinking, okay, I can't even imagine a day when I'm not craving all of my treats and things. Yeah. When you fix the leptin signaling, you won't crave the carbohydrates. And then the weight starts to come off naturally because you're not eating them as much as what you did before. Okay, we still all need, let me make this clear, we still all need a little bit of carbohydrate, but I'm just saying if you're overdoing it, especially the refined sugars and things, you want to decrease those bad carbohydrates. Okay, number three on the list is increase your healthy fats. What does that mean? One of the big ones is fish oil. We need that DHA from fish oil. Helps with our brain signaling, helps to turn on our electrical signals in our body, helps with our leptin signaling. Really, really important. And it is a natural anti-inflammatory. Because remember with leptin resistance that you have that high inflammation in the system because of the leptin resistance, that CRP is high. This is why we need that fish oil, okay? So that's important. And other healthy fats like avocados and things if they're in season. Okay, number four, healthy caloric intake. What does that mean? Yeah, you still got to eat. So this is where the fasting becomes not so great when we're talking about fixing leptin resistance. So people that are doing fasting, intermittent fasting, 1 meal a day, OMAD, it can be a challenge. If you haven't yet fixed your leptin resistance, that is not going to be working for you and actually could be stressing out your system a little bit more. Can make the leptin resistance and the hormonal imbalance worse. Okay, so you got to fix that leptin resistance first. So getting enough healthy calories in the day is going to be important, and having a big healthy breakfast is one of those ways to get some of those good calories in. Okay, number 5 on the list. Don't over-exercise. Woohoo! Okay, I need to see some applause here for everybody who loves this point. Thank you, Tony, for the follow. Please follow. Please make sure that you're subscribed and that you share. So please hit the share button a few times right now on your device and double tap. I love all those hearts coming throughout the show. I can't call everybody out throughout the show, but I'm doing my best. Thank you so much for all your support. Thank you. Okay, so somebody is loving, yes, the She Shed says, yeah, you're loving the fact that I said, okay, don't over-exercise. Well, here's the thing. Over-exercise is actually going to make the leptin resistance worse. Now, I'm not saying don't exercise. I'm saying you still need to exercise, but you want to do this in a moderate way, especially at the beginning when you're fixing your leptin resistance. You don't want to add more stress and spiking your cortisol more at the beginning of fixing this issue. Okay, number 6 on the list is reduce your blue light and your EMF exposure. So what does that mean? Blocking the light, especially in your eyes from all of your devices. You always got to be wearing these, okay? This is really important, especially after the sun has set and it's supposed to be dark in your environment. Wear your blue light blocking glasses. and your EMF exposure. So your cell phone exposure, radiation exposure, you want to minimize that as much as possible. It's going to mess up with your metabolism. All right, and it actually spikes your blood glucose level. So when you're seeing a lot of artificial light all the time, especially at the wrong time of day, this has been studied, it spikes, it raises your blood sugar. So this is something that you definitely want to manage. Okay, number 7 on the list to fix your leptin signaling is get that morning sunlight. You've heard me talk about this a lot. Mother Nature's prescription, this is what we're doing. We're getting that early morning sunlight to signal and to fix your circadian rhythms for the day and to help with your leptin signaling. Okay, number 8, also part of Mother Nature's prescription, is to do your grounding. So get your shoes off, get outside, do your grounding. I've got other tips on how to do that in wintertime. Please check out my content if you need more information on how to do this in an easy way. And number 9, fix that leaky gut. Okay, so where's my poop? Let's talk really quickly. If you're new to the show, hello, hello. This is, maybe you've seen me on social media. This is one of the things that made me go viral and has been posted now in different websites and things in different parts of the world. Yeah, the poop platter, talking about poop. And we talk about it very openly here at the Doctor Janine Show. But we're going to be talking about leaky gut and why it's so important as well. And this is something that we talked about last week. You've got to get your healthy bowel movements going, healthy digestion, fix that leaky gut to help with your leptin signaling to get that weight off. Okay, if you're gassy and bloated all the time, you don't have good digestion, you can't possibly get that weight off because you're not metabolizing and actually getting your nutrients from your food. Maybe you've got the poops that look like this, not so good. Constipation, it's sitting in there too long. Maybe you're lacking those essential fatty acids to move things through, and you've got the rabbit pellets. Maybe you've got the healthy poops. Not too many people have this consistently, and you should be having, ladies, 2 good bowel movements per day, the guys 3 bowel movements a day, just to make sure that you have that healthy digestion. So yeah, I'm not going to ask you to call, and I'm not going to call you out and say, okay, how many poops are you having? Just going to say we're going to be really, gentle on that subject right here, but yes, thank you. Okay, and thank you so much for tuning in. I know we have questions. We will come back. If there's something that we've missed, we can certainly come back towards the end of the show and fill you in if there's something that you didn't understand, okay? So I see some questions here, and Thai Baby has disclosed that having 3 times a day a nice and smooth bowel movements. Okay, so can we have a little round of applause for Thai Baby? Because that's some good pooping going on. Okay, awesome, awesome, awesome. All right, now let's talk about, and I want you to learn more about leaky gut. And how do you know that you have a leaky gut? Well, take a look at one of my videos. And it's
Here are 3 signs
you have a leaky gut. Here you go.
Number 1, you've got a lot of bloating. Number 2, you have Hashimoto's or Graves' disease, so either low or high thyroid, psoriasis or lupus, or any autoimmune disease, as that's usually related to the leaky gut first. And number 3, a lot of allergies. That means that your body and the inflammatory response is happening. You've got that leaky gut. So my tips here, fix that leaky gut, get a healthy microbiome going, some probiotics, and fix that leptin resistance as well. Follow for more natural health tips. Here are 3 signs.
And there you saw it. Fix that leptin resistance. You see how everything is interconnected. Fixing the leaky gut, you've got to fix the leptin resistance. With leptin resistance, you got to fix that leaky gut. So you can see how things come full circle. Really important. And all of my tips, that's what I do, is I share my tips based on my experience over the years and all of my research, of course, and working with my patients over the years as a naturopathic doctor to give you the best information and up-to-date and cutting-edge information about how to heal yourself. And the best thing is how simple it really is. You just got to take the steps to do it. So I hope I inspire somebody who's out there. Share some hearts and some love, please, if I'm inspiring you to do better for yourself and for your loved ones as well. This is all about sharing, and giving and the wealth of good knowledge to our loved ones so that everybody can live a healthier and happier life. Awesome, awesome. Thank you so much. Love you all. Okay, thanks for tuning in. Let's now share some positive feedback from one of our viewers. This is our viewer spotlight, and each week we call out someone who has shared some good news. And this is from Valeria CTF. I'm so grateful for your insightful content. I changed the time I take, and in this case it was her magnesium, from night to morning, and Valeria now has so much more energy. Yay, awesome job. I'm so glad that my tips helped you, Valeria, and I'm sure, if you've got More feedback, please share and comment. Love to hear from you all. So thank you so much for your support, and congratulations for being our viewer spotlight for this week. Okay, which we do have one every week, so keep putting your good comments in there. Amazing, amazing. Okay, we're going to the beauty set. We are going to make a fantastic and super easy hair mask, which helps with hair growth. It helps with the shine of your hair, the sheen of your hair, the strength of your hair. Super easy. You're going to be able to screenshot this in just a second. But as you can see, we're using some avocado oil, which I love. You can even use, this is sort of more the beauty format of it. You can even use the cooking avocado oil, which I often do. You need just a 1/4 cup of it, and you're going to mix that into a bowl or into a glass container if you've got a glass container that you want to keep this, because you may not need, depending on how long your hair is, how much everybody needs for, their head of hair is going to be different. And now we're adding in 10 drops of rosemary essential oil. So if you've heard of the benefits of rosemary essential oil, you know that it's very stimulating to the scalp and to the circulation of the scalp to really get that blood flow going. And this is so amazing because now it is actually helping to stimulate those hair follicles for better hair growth. And you're going to massage that in. So you've mixed it together. You're going to just put a little bit on your fingers, massage it into your scalp. So let's do it on Detox Daisy. If you haven't yet met her, Detox Daisy is going to get a little scalp massage. Yesterday I popped her head off, and so I don't want to do that live just in case bad things can happen when I'm live. Okay, here we go. So you're going to rub in, get it right into the scalp. Okay, maybe I should okay, I don't know. Should I? Yeah. We got to get it on her scalp. Okay, never mind. Pretend I'm getting it all on her scalp. There we go, all on the scalp. You got to really get it in on your scalp and work it out to the ends of the hair. And then sort of tie up your hair, depending on how long or short your hair is. Cover with a towel. And then you're going to leave that on for about 30 minutes. It could be longer. Some people like to sleep in this. I've slept with it on overnight, which I love. Amazing. And then in the morning, you have to, of course, shampoo it out. The other great thing is it actually helps with your scalp health. So if you're prone to dandruff and dry, flaky scalp, the rosemary has a bit of an antiseptic effect as well, because often that dandruff is related to some fungus happening and candida issues. So that rosemary is really going to help to soothe that scalp and kill off some of that bad fungus. Okay, does everybody love that? I hope you do. Thank you. Will castor oil work? Yes, castor oil will work as well. I just like the castor oil is a bit thick for hair mask. It does work. You could add a little bit into this, but I like the avocado oil for whatever reason. I've tried a number of different oils. For the hair, I really do prefer the avocado oil, and it's easier to wash out. Castor oil can be a little bit difficult to wash out sometimes because of the thickness, but it depends on your hair quality and what your goals are for your health. Okay, so here we go. There's the recipe. I want you to screenshot that really quickly, and then we're going to move on. And don't forget, we're making a delicious mocktail recipe. That's coming up. You're going to love it. And we have some quiz questions throughout the show as well as today. So that's coming up in just a second. Okay, did everybody get the recipe? Yes, yes, yes. Okay, Whitehill 1, if people are allergic to avocado, should they use it? No, I would suggest another alternative. You could do olive oil would work as well for this recipe for if you are allergic to the avocados. I wouldn't chance it, okay? Even though you're using it topically, I wouldn't chance it. Okay, we are at quiz question number 1. Are we ready? Okay, so this week we're playing for the AccuBlood Sugar Balance. This is from our great sponsors. Hey, no cheating. Somebody's looking. No looking. Okay. From our great sponsors at VitaTree. And we thank them for making this show possible. It's so great that we have their support. That's how I can come back every week, is from the support of VitaTree Nutritionals. And this is the AccuBlood Sugar Balance. So just like it sounds, balancing blood sugar levels, really important. And okay, are we ready for quiz question number 1? Okay, once the question appears, you're going to have 30 seconds to answer that question. The first one's super easy. Probably some of you already answered. Maybe not. Okay, good. So I covered it up well enough. Are we ready? Here we go. Let's see that question. You can place a blank pack on your belly to help weight loss and leptin resistance. You've got 30 seconds on the clock. Everybody get your answers in right now. Good job, Jerry. I see was very quick to type that one, and even with an emoji. Oh my goodness, very impressive, Jerry. Thank you for participating. Amazing job. And all right, I think, how's our timing going? And we've got 10 seconds left. Thank you very much. Okay, 5, 4, 3, 2, 1. Okay, most of you got it right. some of you were actually a little bit off on this one. Okay, so actually, the other answer that I'm seeing is castor oil. The answer I was looking for, which we talked about today, was the ice pack, but the castor oil pack. So that tells me that you've been looking at my content, because I have talked about a castor oil pack to help with belly fat as well. But I was looking for ice pack, so congratulations to everybody who put ice pack in the answers. Good job. We still have a couple more quiz questions coming up, so don't go anywhere. Okay, now I do want to congratulate last week's winner of the Vitamucil. And our winner was, congratulations to Alina. Alina, yay, good job. So thank you for participating last week. You were our winner. Make sure you see here, follow at Team Dr. J9. This is important. On some social media platforms, we can't contact you, so please make sure that you are following the team, so that if you are randomly selected as our winner, as our participant during the show, that we can reach you to be able to send you your prize. And remember, this week we're playing for the AccuBlood Sugar Balance. Okay, so don't go anywhere. We got a couple more quiz questions coming up. Congratulations, Alina. Okay, let's talk really quickly about vitamin D. Now, this time of year, depending on where you live, we're going to go through some of the most common signs and symptoms of a vitamin D deficiency. And this is so common because, unfortunately, we don't have enough natural sunlight exposure to be able to make vitamin D naturally on our skin and through our systems, which we're going to talk about what you need to have going on inside your body to properly metabolize your vitamin D. So that's coming up as well. We'll also be doing a great back strengthening exercise, and you're going to hear that link to the vitamin D in just a second. Okay, so let's talk about some of the most common signs and symptoms that your vitamin D is low. Is it issues in your mouth? So you could have weak teeth and gums, and prone to infections, and prone to gum bleeding, and prone to having a lot of cavities because of a vitamin D deficiency. We know that vitamin D helps with our calcium metabolism, making sure that calcium goes into our bones and our teeth. So that's why you got to be really aware of this in terms of maybe you are low in vitamin D. Asthma and inflammation in the lungs. Okay, so that, again, we have vitamin D receptors in our lungs, so that's important, as well as diabetes, so balancing blood sugar levels. We need our vitamin D, and osteoporosis, rickets. So yeah, this is something important. We know that vitamin D's got to go into that bone structure, and that calcium helps, and that vitamin D is going to help for that calcium to get in there to make our bones nice and strong. As well as fatigue, low mood, depression. We have vitamin D receptors in our brain, so this is important as to how we're feeling. That's why a lot of people don't feel so great in the midst of a dark winter, because they are lacking that sunshine and, more importantly, that vitamin D. So that's really important as well. High blood pressure, coronary artery disease, and heart disease as well, and muscle aches, weakness, back pain. One of the most common symptoms of a vitamin D deficiency, that low back pain. This is so important because a lot of people don't realize that achy, stiff back is because of that vitamin D deficiency. So you've got to do your best to optimize your vitamin D, and we're going to go through those tips. How do we do that? We'll also be going to the kitchen in just a few moments because I want to share the amazing cranberry mocktail recipe with you that you're absolutely going to love. Okay. Thank you, Anderson, for sharing today's live. Make sure everybody's double tapping your screen. Please share today's live with 5, 10, 15 people. I totally appreciate that. I love to bring more people into the party as we talk about natural health topics, which is so amazing. All right, are we ready? Let's go through now some of the tips for a vitamin D deficiency. What can you do to boost up and bolster up your vitamin D? Okay, so number one, of course, is maximize your sun exposure on bare skin. So depending on where you live, if you're close to the equator, fantastic. You have full, year-round natural vitamin D exposure. The other thing that, if you live far away from the equator, that maybe you need to go on a sunny holiday, if that's not possible, I've got more tips for you because this is really important. Living in a colder climate, we've got to use some of these other tips as well. Okay, number 2 is use a vitamin D app. So there are apps on your phone, if you have a cell phone, that you can actually check your vitamin D. So based on your location, you have to allow the location, services. Based on your location where you live, it will tell you at what time of day you can actually make vitamin D and how much vitamin D you can actually make depending on how much skin you're exposing. So that is amazing. So check those out. Okay, number 3 is optimize your liver and kidney function. So this is really important. Now let's take a look at this really quickly. When we look at liver and kidney function, that in order for either your vitamin D through the sunlight exposure on your skin, which we see here, now we're not always getting that. Some people are supplementing, and if you are supplementing, you're always supplementing with a D3, and something that you can look for is MCTs, because medium chain triglycerides from coconuts actually help with that proper absorption of that vitamin D3, so something to look for. High quality D3 supplement, you can see where does it need to go. So it's, and also from food, I have to say. So some foods like fatty fish, some cheeses, fortified dairy products, not so much. Maybe some eggs, you're going to get a little bit of vitamin D, but in very minute amounts. Fish is probably your best source of some natural vitamin D. Okay, but it's, and mushrooms. So mushrooms that are grown in sunlight exposure, and they've actually studied this. So if you're I didn't plan to draw today, but I know you can all laugh along with my mushrooms. Okay, how do I draw? That's not bad. There we go. So sunlight exposure on mushrooms increases their vitamin D. So eat some mushrooms, okay? And expose them to natural sunlight. That'll maximize their vitamin D. Okay, so despite, where we're getting our vitamin D from, where does it have to go to be activated so that we can actually utilize that vitamin D? It has to go, what do we see here? Proper liver function. So why do you think I'm always talking about detoxification? We got to do full body detox. We have to make sure our liver and our kidneys are also working properly. So liver, kidney health, and then it comes into the gut. Okay, so this is so important that we are making sure that we are optimizing our vitamin D exposure. There we go. That one doesn't want to go away. Here, trying. Okay. I might need help here, guys. All right. How's my wiping skills? I hope I'm getting some. There we go. Okay, that one doesn't want to. Okay, now. Oh my goodness. Okay, somebody's going to have to help me with that. There we go. All right, so let's talk about now vitamin D tips and how do we fix that deficiency. Well, we talked about that. Okay, we're on number 4. Let's go to lose weight. Yes. So the more of we have, unfortunately, of that body weight, especially that central obesity, what happens is that we can't do that proper conversion from the liver and the kidneys, and our vitamin D actually gets trapped into our fat cells. And when it's trapped in our fat cells, then we have a problem in terms of not being able to access that vitamin D appropriately. So the more fat you've got, that belly fat, that's going to lessen your vitamin D utilization in your body. So something to be aware of. So losing weight is really going to help with your vitamin D deficiency. As well as number 5, fix that leaky gut. So we just saw earlier that leaky gut syndrome. So important that we're fixing that leaky gut. Okay. Now, please make sure you're sharing today's live. It's so great to have you all here. We are going to have quiz question number 2 in just a second. Hello, Plush. Nice to see you. Thank you for tuning in. And yes, it is so great to have you all here. Thank you so much for tuning in. And please hit I love when I see all of those hearts coming through. You guys are the best, and you're so, positive throughout the show, which is so amazing. Okay. Let's talk about quiz question number 2. So once that question comes up, you've got 30 seconds to answer, and then you can randomly be selected if you have participated. You don't even need to get it right, just do your best to actually win a prize, okay? We will be going to make that mocktail in just a few moments. I'm super excited about that. Let's go. Quiz question number 2. Name a vitamin D deficiency sign or symptom. Something that we talked about just a few seconds ago. You've got 30 seconds on the clock. Okay, everybody go. Let's go. All right, thank you. Thank you, Alana, for sharing today's live. So great to have you here. Thank you for tuning in. And Kathy in Sonora, California, thank you for tuning in. I hope that you are able to answer the questions. Good job, everyone. Okay, I see a lot of activity is happening. All right, everybody's getting their answers in. Hey, if you know more than 1 or 2 of the symptoms, you've got 10 seconds left. Please put them in. Please share. Show us your smarts. Good job. Okay, 3 seconds left. 3, 2, and 1. Everybody got their answers in, I hope. Okay, so what are some of the deficiency signs and symptoms of vitamin D? We talked about them. So issues in the mouth, periodontitis, gingivitis, asthma, Diabetes, so issues with your blood glucose levels, weight gain would go with this as well. Osteoporosis and weak bones, of course, fatigue, low mood, depression. I know a lot of you had this one. And high blood pressure, coronary artery disease, and heart disease, muscle aches, weakness, and a lot of you put back pain, which I'm so happy about because this is something that we absolutely need to get, under control. If you do have chronic back pain, one of the reasons that it could be related to a vitamin D deficiency, but it could also be related to your back muscles being weak. And unless you're actively training, your full body, so doing full body workouts or lifting weights and training your back can be weak, and that's why you have the pain. You don't have the pain because, you've pulled something. You have the pain because your muscles are weak and you've got to strengthen. And here's one of my favorite exercises to be able to do that. It's called an upright row. And the upright row can be done with a kettlebell. So a kettlebell is amazing. You can also do this with free weights. You can do it with a soup can, a water bottle, whatever you like. And the key to this one is to keep your back flat, okay? So your opposite leg is going to go up on a stool, a chair, the couch, a bench, whatever you have, okay? So you want to stabilize your opposite. So I'm holding my kettlebell in my left hand, so my right leg is going to be stabilized on my chair. And then you bend over. Now you notice that my back is flat. This is the key. Okay, so back is flat. You're going to tuck in your tailbone just a little bit to protect that low back. Then you're reaching forward, and then you're pulling up with that kettlebell. And this is going to use so many different muscles, and I'm going to show you that in just a second. And we are targeting basically the entire body. And you're going to repeat. Usually I do 12 repetitions on each side. You can see I kind of busted my fingers, so I can't do it on the other side today, but you're going to do 12 repetitions on one side, go to the other side, 12 repetitions, take a little break, and then repeat. And do that 3 times over, 12 reps on each side. Amazing. It strengthens all of these back muscles. Let me show you these really quickly. Can I show them here? Yes? Okay, awesome. So you're going to be helping to strengthen your traps, the lats. So the trapezius muscle, as you can see here, the lats on the side, your rhomboids, the teres minor, infraspinatus, rhomboids, as we can see here. So some of the deeper back muscles, you're even helping with the scapula and these levators here, as well as your lats, which of course are on the side, the obliques, as well as your deltoids. So this is also for your shoulders, and for your biceps and the brachioradialis, as well as your core muscles. So it really is like a full body workout just in doing those upright rows, which is amazing. So I hope you try this. Please try this, and you can even do it without weights. So if you're working on strengthening and you're just starting with strength training, you can do this without weights as well. Just be really focused on those muscles that you're working, and this is going to do amazing things, especially if you do have back pain. Do these reps every day. It will do wonders for you. Okay, so I hope you love that. Thank you so much for tuning in. Ahmed, thank you for following. And thank you to all the new followers that are here. Let me just shout you out really quickly. Thank you so much. Thank you for sharing today's live as well. So please hit that share button. Make sure you're double tapping your screen, which is always amazing. I see all of that love and those hearts coming through, which is so good. And we still have, I believe, one more quiz question left. Yes, we do. Yeah, we have one more quiz question left, so you still have the ability to win a prize. Okay, are we ready? Let's say hello and thank you to all of the super fans. So there's so many of you that throughout the week between shows when we're live here and during the live shows, you're actually donating. And this is so, so amazing for the channel. Thank you for supporting me and everything that I do. It really does help to motivate me and make it possible for me to actually come here every week to share this fantastic research and information with you. So thank you so much. I truly appreciate all of you. Everybody is so, so kind here, and I thank all of you. So thank you for tuning in. Hey, and if you're here for the first time, we do this every Tuesday at this time zone. This is when we talk, 11 a.m. Eastern Standard Time on the Doctor Janine Show, and I share a different show every week on different health topics, okay? So thank you for tuning in. There's a reason that you tuned in today. I'm so happy that you are here today. Okay, we're going to the kitchen, woohoo, my favorite part, and we are making an amazing mocktail recipe, and this is a holiday cranberry mocktail recipe. And then there's 2 ways of doing this, which is so fun. One is you're just going to use a standard glass. You could use a wine glass, you could use another cocktail glass, which is totally up to you. Or you can go the extra mile and make like a snow globe, so you can freeze, if you can do it, freeze your rosemary, because it's going to have cranberries and rosemary. So you're going to freeze your rosemary into some ice in the freezer in your glass, and watch how cool this is. And all we're doing is we're adding in, so I've already got my ice in here. You could also add ice cubes into your glass, so I'm not going to use that one. And you're going to muddle some of the cranberries. Now these are frozen cranberries, beautiful, you know, because they actually help. And I've got, you can say, hey, I didn't even say, I'm so rude, I didn't even say hello to Lucy. Lucy's going to be drinking some mocktails with me. I don't know, Lucy, do you prefer the mocktails, or you prefer the real stuff with the alcohol? I don't know. She can't answer, but I don't know. We'll see. We'll see. Okay, so we are making the cranberry mocktail, of course, without any of the sugar, which is great. We know that in terms of our health, that cranberries are amazing because they help with our kidney health. So we talked a little bit about kidney and liver health, our liver as well. Having the cranberries is amazing because this is so important for liver and kidney health, to make sure that we are optimizing, of course, our vitamin D absorption, remember. So that's really important. Always working on full body detox is something that I love to talk about. And when we're talking about doing a holiday mocktail with the cranberries, I mean, great for your urinary tract health as well, which is amazing. Okay, so you can see that I've frozen my rosemary into my glass. Everybody can see that, amazing. Oh yeah, and now we've got the, oh, this is so cool, yeah. Okay, awesome. Now I'm going to, and I've muddled a little bit of the cranberry. I'm just trying to get some of the juice in here. I could muddle these in the glass if I didn't already have the ice in there for my little effect. And I'm just going to pop those cranberries into that glass. And I am going to, whoopsie, I knew I was going to do that. I always do fun things on live. When I'm on live television, fun things happen as well. I'm going to now add a little bit of stevia for sweetener. And now remember, this is low carb, this is keto friendly, this doesn't have sugar, and it's not going to spike your blood glucose levels, so it's leptin resistance friendly as well. So as you're fixing your leptin resistance, remember to lose that weight. This is amazing without the alcohol, without the sugar, which you're going to love. Okay, so I've got my cranberries in there. You can see my glass is there. I froze it with the rosemary sprig. And now I'm just adding, and I've added in my natural sweetener. You could use monk fruit as well. Now I'm adding in my sparkling water. And that is it. You don't even need to stir this, because pouring it in slowly is going to help to mix in that stevia and the cranberry. Now my little snow globe is lifting, but that's okay, but you get the idea. And there you go. Isn't that beautiful? So now it's like a little snow globe. And there you have it. Isn't that awesome? I want you to make this at holiday time. It is so fun and so delicious, and it's supposed to look like a little Christmas tree if we get the full effect there. Have we got it? Yeah, there you see. See how it's like a snow globe with a little Christmas tree? Awesome, awesome, awesome. You're going to totally love this, and your guests, if you are entertaining, your guests are going to love this fun and delicious. Okay, so let's just say, now you could do it with a straw or not. So refreshing. It tastes sweet, but without the sugar, which is amazing. And let me just take this with me over here so that you can screenshot the recipe. You are going to love this. And it's something that, hey, if you want to add a bit of gin into here, you totally could. That would probably be the way that I would go if you wanted to add the alcohol. But hey, we're fixing our leptin resistance. We're losing weight over the holidays, right? So this is something that, yeah, going with the mocktail is definitely the better way to go. Okay, so here you go. You've got your cranberries, your rosemary, your sparkling water, and of course, stevia or monk fruit to taste, because that will naturally sweeten it without adding the calories, the sugar, and of course safe for diabetics as well. Those cranberries, great for your urinary health, which is amazing, and helps with liver health as well. So helps as a gentle detoxifier. So a great way to get healthy and enjoy the holiday season. Okay, we're at quiz question number 3. Thank you, thank you, thank you. We'll come back to that. If you missed it, if you weren't able to screenshot it, we'll come back to it in just a few minutes. Okay, last quiz question for the day. Remember, we're playing for the AccuBlood Sugar Balance from our great sponsors at VitaTree. We thank them for making the show possible. Is everybody ready? Yes? All right. Thank you, Jerry, for sharing the live. Awesome, awesome. Thank you for the follow, Lori30C37. Thank you for tuning in today. I'm glad that you caught the show. And we'll come back to anything that you may have missed in just a second. Okay, quiz question number 3, final quiz question for today. Name a muscle that's worked on when doing upright rows. Let's see who was paying attention to a little bit of anatomy. You got 30 seconds on the clock. Get your answers in now. All right. Everybody get your answers in. Nice, nice. Okay, I see. Yep. I see some good answers here. Awesome, awesome. 5 seconds left, everybody. Thank you. And all right, everybody got their answers in? I think so. Good job. And I'm glad that somebody, Leanne Lee, put the deltoids in. Allie Christie said shoulders. Thank you. GC 143, good job. Yes. So good job, everyone. So trapezius, some people were putting trapezoid. I see some people were looking at other people's answers. That's cheating because you got the wrong answer. Hello, hello. Yes, so trapezius muscles and the lats as well as the deltoids, so the biceps, so you're working your arms as well with the upright row, the brachioradialis, and your core muscles as well, which is amazing. So it really is like a full body workout just in doing that one exercise. Strengthening the back. If you got that back pain, it could be related to that vitamin D deficiency, which we talked about earlier if you're just tuning in now, so make sure that you're addressing that, okay, and some of the signs and symptoms of vitamin D deficiency. So if you're just tuning in right now, we've talked about weight loss today. Where's Mr. Fat? Oh, here it is. We talked about how to get this dreaded weight off, especially over the holiday season. That's why I share my delicious mocktail recipe, which is amazing because it's low in sugar and fantastic for balancing the hormones. We also talked about signs and symptoms of being low in vitamin D. I did my hair mask, which I love to make. It is amazing, helps with hair growth as well. And we did the upright rows, the back exercises. So if you have any questions, now would be the time. Please put your questions in and put them in the comments right now. I'm going to try to answer a few before we say au revoir. And for, okay, Farm Gal 66, what do you take for a degenerative spine? So this is something that we've talked about in a previous show. We don't have, oh, Ricky's not here today. Okay, next week we'll bring out Ricky for degenerative discs. And vitamin D is very important, proper hydration. So yeah, let's bring that mocktail back. Doesn't that look pretty? Oh, it looks so pretty. I actually matched the cocktail today. I didn't even plan that. Look at that. Oh, delicious. So proper hydration, whether it's a mocktail that doesn't have sugar, increasing your water consumption is one of the most important things, as well as sunlight exposure, red light therapy. These things are really helpful for degenerative spine, degenerative discs, okay? And, okay, Farmer's Wife 315 wants to see the hair mask recipe. We're going to show you that right now. Susan Carr 88, how often do you do the hair mask? Great question. I was waiting for this, Susan. Good job. You can do this 2 to 3 times a week. You don't want to overdo it with the essential oils, so 2 to 3 times a week max. That may be even too much if you have sensitive skin, so maybe, once every 2 weeks. It really is individual, so you do it once for the first time, see how it feels. And to be honest, with my timing and my schedule, I usually, like maybe once a month I'm doing it, but yeah, whenever you can do it is great, but you don't want to do it too often, okay? Yes, isn't this, I know, it is gorgeous. It's the most beautiful thing. You're gonna absolutely love making this. Hey, who made the spicy margarita from last week? I want to see that as well. Please let me know. Enjoying life. Thank you for the follow. It's so great to have you here. Thank you. Okay, so this was last week's recipe, and then I think we have to pull up the other one as well, right? Is that, oh, the hair mask recipe we'll go to next. Oh, it was the hair mask. Okay, so as I was talking, yes, the hair mask. You saw the hair mask recipe. All right, awesome. Here is the spicy lard margarita. This is what we made last week. So a different mocktail that we made last week. If you missed that, did anybody make it? I don't know, my team. Did anybody say yes that they made it? Yes? Okay, awesome, awesome, awesome. So this was last week, delicious. Oh my goodness. It's gonna be, okay, so yes, awesome. Oh, you did it 2 times. Yehudas Johanna, yes, awesome job. Didn't you love it? Well, obviously, if you made it 2 times or more, then you did like it, which is amazing. Okay, and here is the Mary Berry sparkling recipe that we had. Was this 2 weeks ago or 3 weeks ago? 2 weeks ago. This was a different recipe with the lemon juice and the muddled berries. In this case, we used raspberries. This was a couple weeks ago, which was amazing. The sparkling water, a pinch of stevia, monk fruit to taste, and the ice cubes. And I saw a question came in with the monk fruit. Yeah, if you tolerate it well, I mean, you have to kind of look for ones. Sometimes they have the sugar alcohols in them. which some people don't like and don't react too well with their gut health. With the sugar alcohols, it can make you gassy and things. So just make sure it's a pure monk fruit if you are sensitive to the sugar alcohols. If you have a little bit, most people are going to be okay. And stevia, it's making sure that it's not mixed with other things, because they put sometimes other things in with the stevia. So you just have to do your due diligence to really read your labels well when you are purchasing stevia, monk fruit, or anything. You could use, hey, if you really wanted to, you could put a splash of simple syrup in here. I don't like sugar, but if you're having one of these like once a week, it's not the end of the world. Let's be realistic here that, yeah, we do our best. And that's why I love the 80-20 rule, which is what I follow most of the time. 80% of the time you're doing well, you're following all the tips, you're doing everything good. 20% of the time you fall off a little bit in terms of, not being perfect all the time. I think it's just a safer, easier way to live and to be healthy for the long term, right? Because people can get into these, kicks of doing keto and no carbs and being super, super strict, that this is so important that you definitely want to make sure that you are staying with it for the long term for your health. Okay, and I want to call this up as well. Please share your stories. So if you've been able to follow any of my advice, I focused here on the leptin resistance. If you were able to lose weight, I know a lot of you have been, and you share that in the commenting on social media. Please send us an email. Please, I want to potentially use anonymously if you prefer in my new book that is in the final edits now, and please share your story. info@drjaninelive.com. Send an email, please, 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 to my team, so that potentially you can be used, and maybe we could do an interview. There's so many different possibilities. I don't want to scare anybody, because not everybody likes to talk in front of cameras and things, but if you can just write in your testimonial, that would be amazing, because I want to share the good news. Other people need to know that, these things like fixing your leptin resistance, which worked so well for me, and hey, I would have thought I take good vitamins, I eat a good diet, I'm on top of my health. I never knew that leptin was even a thing. It's not even something that we learned about in school when I was studying as a naturopathic doctor. It's something that I had to educate myself on and do a lot of research on, and it helped me so much with my hormones, my thyroid, losing weight, getting off of the carbs, getting off the alcohol. Really, really made distinctive differences for my health and my energy levels. So this is so, so important. So please, if you've been able to lose that weight, whatever, you've been able to help your own health, hey, maybe you just love the mocktails, please send that email into the team so that we can potentially share that in number one in my book, which would be great. But also maybe here on the show as well, which is amazing. Okay, Jacinta is asking low iron foods. We actually have a video on that, so that maybe that's something that we can actually talk about next week, how to increase our iron naturally. There are foods. One of the things, figs are great, loaded with iron. Blackstrap molasses also has iron. And there are other, high quality whole food supplements. That's the fastest and easiest way to get your iron up in a natural way that's not going to upset your stomach. So that's usually the way that I like to go. So increasing iron is something that maybe we'll talk about next week in our show, which will be amazing. And hey, if you've got a call out, if there's something that you want us to talk about in one of the shows, please put in the comments, which I totally appreciate, which is so amazing. I actually base the shows and produce the shows based on what the demand is for what everybody's asking about, which is amazing, based on the commenting in all of my social media posts, which is great. Endometriosis. Okay, I know. S, thank you for putting that in. We will talk endometriosis. I know that question comes up a lot, and maybe, just pain, lower abdominal pain, which is something that we can definitely work on. Amazing, amazing. How often to do the hair mask with the rosemary? So let's go over here for just a second. If you're just tuning in, I'm getting this question a lot. How often can we do this? If you're new to doing it, if you haven't used a lot of essential oils on your scalp before, I would probably do it once a month. And then you can, gradually increase that depending on what you're wanting to work on. If you're trying to work on, actually not just the hair growth, but actually if you've got dandruff or if you've got a fungal issue happening on your scalp, then you may need to do it a little bit more frequently. So that's something that we can, definitely do a little bit more often if you feel you need to. Oh, Ravi Jill, 1154, unwanted hair growth on the chin, which is usually something that has to do with PCOS in women, and of course with everything that we talked about today, so the leptin resistance and the insulin resistance, metabolic syndrome. So actually that's a great topic that would tie in a lot of these things, is metabolic syndrome. Okay, so that's something that you're going to see next week. And see, I think on the fly. This is how life goes for me. Thinking on the fly, we're going to talk about metabolic syndrome next week. That's so important. That ties into what we talked about today with leptin resistance and getting the weight off and the fat loss as well, which is amazing. Okay. And there's more questions coming in. I know my team behind the scenes is working really hard to try to answer all of your questions, which is amazing. So just be patient with them, which is great. And thank you so much to everybody who shared today's live, and thank you for double tapping your screen. So let's get a few more double taps in there just to round out the show, which is so amazing. It was so great to have you all here today. Remember that next week we will be tuning in at the same time. So if you caught the show late today, we had some quiz questions. You have the ability to win a prize. I'm going to mention next week's winner, today's winner in next week's show. So make sure that you are tuning in. And thank you so much for tuning in today. Make sure that you check out all of my content. If you're new to me and you're a new follower, new subscriber, make sure you're sharing with your friends and let them know that there is a lot of natural health information that I share here on the show and all of my content on all of my channels that really is meant to help to inspire you to be a better you so that you can get healthier and to do it in a natural way. Thanks for all the love, everyone. Thanks for tuning in. It was such a great show. We'll see you next week. I can't wait till then. Check out all my content from now until then, and we'll see you then. Bye.